Good afternoon, everyone, and welcome to our webinar today titled Employment Supports and Benefits Planning for SOAR Beneficiaries. My name is Pam Hine, Senior Project Associate with the SOAR TA Center, and I will be your moderator today. So before we begin, just a few housekeeping items to review. Here we go. So a quick disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Use and Mental Health Services Administration, or the Department of Health and Human Services. Thank you. So some webinar instructions. As a reminder, your lines will be muted throughout the entire webinar. This webinar is being recorded and will be available for download on the SOAR website in about 1 week. There are a couple of ways you can download the PowerPoint slides and other handouts. One is to go to the chat box. We'll have a link to the slides there. You can also go to the SOAR website at www.soarworks.samhsa.gov. You can get the slides also on our website too, so you can get them that way. As you can see, we also have live captioning and ASL interpretation. Thank you. And you can utilize that by clicking the closed caption button at the bottom of the screen too. And again, at the end of the webinar, we will take some Q&A. You'll be able to put some comments and questions in that Q&A box that you see below. So we'll be leaving some time for questions at the end. We also have an evaluation that we ask that you kindly complete. It helps inform future webinar topics as well. Susie, can you help me change the slide? For some reason, I'm not able to forward. Great, thank you. So purpose and objective. So it is really our intention that by the end of this webinar, you'll have a better understanding of how to utilize in your communities and within your agencies benefits planning for individuals returning to work or trying on work for the first time, and understanding what is individualized placement and support, what is this supported employment, and how can you utilize this supportive services to help individuals return to work. And again, how to access these, these supports within your community as well. And we'll be sharing a lot of resources created by the SAMHSA TA Center and some other resources around the country and in your communities as well. Next slide, please. So to reach those objectives, we have some wonderful panelists today. Lindsay Horn, who unfortunately is not able to present, had a big hand in creating some of the slides that our next presenter, Lindsay Weber from Oklahoma, a SOAR trained case manager, as well as an IPS employment specialist from Oklahoma, Grand Lake Mental Health Center, who will really talk about how to implement IPS within your area and talk about the principles of what is IPS, supported employment. And we're really lucky to have Kirsten Silver and Takia Blackman, both with the Maryland Benefits Counseling Network in Maryland, who will really talk about in more depth benefits planning and giving a perspective on how really benefits planning can really help folks understand, returning to work as well. And then we will leave time for a Q&A. Next slide, please. So we're really fortunate to have Asha Stanley from SAMHSA to do our welcome today. Asha?
Thank you, Pam. A warm welcome to all of you joining us today. On behalf of SAMHSA, I'd like to welcome you to this webinar, Employment Supports and Benefits Planning for SOAR Beneficiaries. October is National Disability Employment Awareness Month. The SAMHSA SOAR TA Center is proud to promote employment for SSI, SSDI beneficiaries. Today's webinar will give you many practical tips and tools to help you better understand how to assist SOAR beneficiaries with accessing employment resources. I like to welcome and thank our presenters for your willingness to share your expertise with us. I will turn it back over to Pam Hain, who will be moderating today's webinar.
Thanks again, Asha, for your warm welcome. Well, now joining us will be Lindsay Weber from Oklahoma, who's going to kick things off for us. And we'll wait for Lindsay. I'll give her some time to get her camera turned on and to get situated. And Lindsay, if you need support with changing slides, we can do that for you at the TA Center.
Okay. Can you guys see my video?
Yes, we can.
Okay. My name is Lindsay Weber. I work for Grand Lake Mental Health Center in Ponca City, Oklahoma. And it won't let me control the slides either, just by the way. And Grand Lakes is a community mental health center, and we operate in 11 different counties, in mostly northeast Oklahoma, but we're kind of spread into north central Oklahoma, and that's where I am. We provide services allowing for consumers to optimize their personal, social, and vocational competency in order to live successfully in the community. We help people with serious psychiatric disabilities function with success and satisfaction in their environments with the least amount of professional intervention as possible. So we work with community integration services to benefit consumers by optimizing their potential for occupational achievement, goal setting, skill development, and increased quality of life through education, training, and support to improve their mental health and promote lifestyle change and recovery. We have a recovery orientation, including recovery-oriented treatment plans, individual goal settings, and a staff philosophy of recovery that permeates all service elements and activities. Next slide. We operate individual placements and supports. We'll call that IPS. So I'm on the IPS team, and I'm an employment specialist for Grand Lake. And we offer supported employment, and it's a program that helps people with mental illness and or substance abuse disorders find and keep jobs, while at the same time providing employers with access to motivated employees. So half of IPS is working with employees, with clients, assisting them with figuring out what it is that they want to do. It's very client driven, what their interests are. We want to find something that they're going to feel invested in. And the other half of our job is going out into the community and building relationships with employers. We market IPS to employers as a way to fill gaps in their workforce and to provide supported employees. So depending on what the client wants and how much disclosure the client is interested in, we continue to work with the employer and the employee after they're employed to make sure that the transition into employment goes smoothly and that employment can be maintained. Next slide. So IPS is a highly successful evidence-based model of supported employment that promotes a recovery through work philosophy, where individuals with severe and persistent mental illness and co-occurring disabilities achieve competitive integrated employment services when assisted with ongoing support services. So when we say recovery through work, I think it's an important thing to realize that where IPS, the model, works as they recover through work, not that work, that they have to be recovered to work. So that's gonna, whenever we go through the principles of IPS, that's gonna come up over and over again. But we are working with clients when they feel like they're ready to set employment or education goals. And so when they feel like they're ready, there are no exclusion criteria. And then we continue to work with them on going after employment. IPS is the most researched and best described model of supported employment. And because it's evidence-based, there are several tenets of fidelity that each program meets. Next slide. One important part of IPS is that it's very client driven. So we ask the client, what do they want? Do they want to further their education? Do they want to pursue work? Do they want to build a career? What kind of life do they want to live? Those are all very important things that we want to know, so that whenever we're guiding them and bringing them job leads and bringing up ideas, that we can give them something that they're going to feel invested in, something that they have chosen. We don't place people anywhere. So for example, we have a client that wants to work at a fish hatchery. And that's what he's passionate about. That's what he's interested in. And so, that's the direction that we've gone. And we may not be able to find him a job specifically at a fish hatchery, but we're going to find him something, science-based or wildlife-based, something that he feels. We're going to take all of those leads to him, and he's going to decide where it is that he wants to apply and invest his efforts. Next slide. So IPS is based on 8 key principles: zero exclusion, worker preferences, time unlimited supports, benefits planning, integrated services, a rapid job search, and competitive employment and systematic job development. And we'll go over what each of those things mean on the next slide. We'll start with zero exclusion. So zero exclusions means that people are not excluded on the basis of readiness, diagnosis, symptoms, substance abuse history, psychiatric hospitalizations, homelessness, level of disability, or legal system involvement. We do not exclude anybody. When somebody says that they're ready for supported employment, we're there to step in. So sometimes that makes things a little bit complicated, but we don't want to turn anybody away that's willing to work. So any client of Grand Lake Mental Health qualifies for IPS services in our area, and we don't turn anybody away. Next slide. The next is worker preferences. IPS program services are based on the job seeker's preferences and choices, not our employment specialists or supervisors' judgments. So oftentimes we'll get clients who have like a significant criminal history or a drug history that, shows whenever that people do a background check, and they want to work in a pharmacy. Well, that's probably not very likely. That's not something but we don't discourage them. We try to find alternative solutions to still get them where they want to be. Next slide. Time unlimited supports. Job supports are individualized and continue for as long as the worker wants and needs the support. I followed one of my most recent clients. I followed for 1.5 years. After he had found employment, he had maintained employment, and he had developed a relationship with his supervisor where he could work through issues that came up more effectively than he could previously. And I just continued with him until he felt comfortable that he could do it without somebody, to bounce things off of. And so we have face-to-face with each client, face-to-face contact at least monthly. With the pandemic, that's been a little bit difficult. Grand Lake is really lucky that we have a strong telemedicine program in place prior to the pandemic. And so we were able to maintain contact with each client. Has an iPad with Grand Lake. So over the iPad, we had, different telemedicine options. So even when we couldn't meet face-to-face monthly, we still got to see each other. But for most clients, we see them weekly on our team. Next slide. Employment specialists help people obtain personalized, understandable, and accurate information about their Social Security, Medicaid, and other government benefits. I'm a CWIC 50% of the time on the IPS team, work incentives benefits planner, and the other 50% of the time I'm an employment specialist. So each client on the IPS team has benefit planning services available to them. And later on in my presentation, I'll kind of go over a story of before we had that and why we realized that that was something that was missing from our team, and how we provide that service. Next slide. IPS principle number 5 is integrated services. So IPS programs are integrated with our mental health treatment teams. At least monthly, each of our clients on the IPS team are staffed with their mental health team. So we will go to their mental health staffing, attend, and make sure that we not only staff the client and the client's needs with their mental health treatment team, but also participate in the staffing to see if there are employment related issues for other clients that may benefit from IPS services. Most employment specialists attach to 1 or 2 mental health treatment teams and discuss their caseload. Next slide. IPS principle number 6 is a rapid job search. So we use a rapid job search approach to help job seekers obtain jobs rather than assessments, training, and counseling. The first face-to-face contact with employers occurs within 30 days. So we don't want to spend an awful lot of time doing assessments right at the beginning, because oftentimes our clients are in a hurry, and they're ready to start looking for employment. So we try to minimize the amount of time we spend doing assessments right in the beginning and work on just following up on job leads, just figuring out what their needs are, just figuring out what it is that they want, and providing, the leads that they need. Next slide. And IPS principle number 7 is competitive employment. So we're not looking for like sheltered workshops, things that we're looking for, jobs that anybody can apply for, that pay at least minimum wage, where our clients will make the same pay as coworkers with similar duties, and no artificial time limits imposed by the social service agency. So we want our clients to be employed in the community at jobs that are available to anybody at the same pay rate. Next slide. IPS principle number 8 is systematic job development. We systematically visit employers. We select employers based on the job seeker's preferences, and we learn about the employer's business needs and hiring preferences. So I can say right now, for example, I have a client who is interested in office work as a receptionist or secretary. She has minimal experience, but she has some training. And so what I've done is gone through and found job leads in my community that are office related, and gone to those employers and asked, what's their application process like? What kind of experience and education are you looking for? What is an ideal candidate for, these posted positions look like? What's the best way to apply? Who's in charge of hiring? I want to know all of those things. Excuse me. And okay. And the goal is to build a relationship with the employer so that they know who we are. They know the service that we provide, so that later, if they have a position and they think, that they're having trouble filling, or that, they need filled quickly, that they think, well, maybe IPS at Grand Lake, maybe they have somebody that's interested in that. So we want to build that relationship with the employer, continue to visit with the employer. Next slide. IPS specialists are there for the long haul. So we aren't going to, somebody isn't going to be disqualified from the IPS program if they relapse. Somebody's not going to be disqualified from the IPS program if their symptoms worsen. What we're going to do is we're going to staff with their mental health team. We're going to discuss what we're seeing. We're going to discuss how, with the treatment team, how that's affecting their employment. We're going to make sure that the therapist and the medical providers all understand what it is that we're seeing, and, you know, provide services based on where the individual is. So like, it's a long road with some of them. You know, I've been with the agency for several years, and there are clients that I've had for 2.5 years. It's been a bumpy road, but when we don't give up, when they know that we're not going to give up, and that, you know, they're always going to have that support there as long as they want it, then I really do think that it benefits our IPS clients. Next slide, please. The effects of unemployment in education is increased substance abuse, increased psychiatric symptoms, reduced self-esteem, and alienation. I think that with a lot of my clients, the thing that I notice the most once they become employed is their sense of belonging to the community, their sense of connection with the outside world, really assists them in their recovery. It really is a game changer. Next slide. The benefits of working or getting education is they have increased income, which is always a huge relief, improved self-esteem, increased social and quality of life, better control of symptoms, reduced substance abuse, and reduced hospitalizations. Next slide. So IPS all boils down to the original question, which is, what do you want? I have a client who's 50, who got his GED when he was 18, and he's never returned to college, and that's what he wants to do. And I've seen him blossom as a student, and really like learn about things that he's passionate about. And I just think that that's awesome. And that connection to the community has really built his self-esteem, which just benefits his recovery in so many ways. You know, but I also have clients who are like, I just want a job. I just want a job. I don't even care what kind of job. I just want a job. And they get a job cleaning motel rooms, and they're perfectly happy. And they learn, they get new connections to the community, and, you know, it makes them feel valuable and needed. And, you know, and that's what they wanted. That's where they wanted to be. So, you know, it's not always some big grand goal. Sometimes they just want a little job, and they want to be able to do that, and they need support to do that. So IPS is there to provide support for any of the paths that clients would want to take. Next slide. Questions we ask in Oklahoma. We have several agencies that provide IPS services. 12 and 12, which is an inpatient drug and alcohol treatment facility. Family and Children's Services, Hope, North Care, the Mental Health Association, Grand Lake Mental Health, and Red Rock Behavioral Health Services. Those are all agencies in Oklahoma that provide IPS services, and there are IPS teams at several of these other locations. Lighthouse and Catalyst are both inpatient facilities, but Northwest Center for Behavioral Health is also a community mental health center like Grand Lake. Next slide. Why do they recommend the IPS model of support? For one, it's completely free. Two, it's evidence-based. Over 65% of individuals with serious mental illness want to work. Participants in IPS are nearly twice as likely to keep their job. There are less hospitalizations. There are no evidence of negative effects from the IPS model. IPS is effective with a wide variety of issues: serious mental illness, substance abuse disorder, post-traumatic stress disorder, first episode psychosis, homelessness, and legal system involvement. IPS is truly working is recovery, not you have to be recovered to work. Next slide. So we've successfully implemented an IPS team with Grand Lake Mental Health. We implemented IPS with individuals experiencing homelessness, with mental health and co-occurring disorders. So we have worked very tirelessly at Grand Lake to implement the SOAR program throughout our community mental health center. So in each of our clinics, there is at least one staff member who is SOAR certified to help with SOAR applications. And we have members on our IPS team who are SOAR certified to help with SOAR services for clients who are interested in work. And I offer benefits planning services to each member of the IPS team, or each client of the IPS team. So every single client that receives IPS services is referred for benefits planning now. Wasn't always that way. I was gonna share a story about, I was an employment specialist before I got my CWIC certification. And I had a client who had 2 little kids, and she hadn't worked in several years, and housing had gotten her an apartment, and she said she wanted to work. So I jumped right in and helped her secure a job. She got a job at online grocery pickup at our local Walmart, and she loved it. She did very well. She got her first paycheck, and it was $400 or $500 for 2 weeks. She had managed to find daycare for her kids, and things were going well. She loved being employed again, and then she turned her first paycheck stub into her landlord for HUD housing. She was living in income-based housing, and they said her rent was going to go up to $600 a month. And she got exceptionally discouraged. She's like, I'm not going to be gaining anything by working. I'm going to have to pay everything that I earn from working and rent and daycare. And so it's easier just to stay home and not do it. And so she not only quit her job, she quit IPS completely. And I think if we would have been working harder on benefits planning and approaching those topics with clients before work, that we could have kept her engaged. We could have found her a job that she could still get the benefits of work and not lose any financial benefit from working. Making her rent. And I don't blame her for panicking. I would have panicked the same way as a single mother. So, we've changed the way that we do things. Now I'm a benefits planner, and each client before work is referred to me, and we make an individual benefits analysis for each client. So I think that that's something that's unique to Grand Lake that we've implemented, and it's working really well within our agency. Next slide. That's it.
Thank you so much, Lindsay, and especially thanks for sharing your lessons learned about how to approach applicants, beneficiaries, to help them understand how benefits could impact housing, for example. So thanks for sharing that, because I think that can really help other SOAR trained case managers who are doing this work to avoid that dilemma as well. So thanks again. Now we're moving on to Kirsten Silver in Maryland, who's going to go more into depth about benefits planning and some of those SSA work incentives. Kirsten, thank you.
No problem. So I hope everybody, can you hear me, Pam? Am I good on voice? Oh, awesome. Okay, so my name is Kirsten Silver. I am the Director of Self-Sufficiency and Education with the Maryland Employment Network and the Maryland Benefits Counseling Network. I wanted to start off by saying that I loved Lindsay's presentation. I actually started as a benefits counselor in an IPS program as well. So I'm a little bit biased in terms of the effectiveness of IPS and the importance of benefits planning. But I'm here today to talk about kind of a little bit of work incentives, how you can access benefits planning if your agency or the agency that you're making a referral to doesn't have that service in place already. So the first question is why work? And I think that Lindsay really hit on a lot of the recovery aspects of employment right off the top. You know, the improved social skills, the sense of community and purpose, having an identity, something to do with your time. All of these things are wonderful, and they certainly contribute to somebody's recovery when they are living with a mental illness or a substance use issue. On the other side, on the financial aspect, when we look at benefits, approximately 28% of SSDI only beneficiaries are living below the federal poverty level. So that's a pretty big chunk. And we know that the amount of SSDI that somebody may receive is based, or another Title II benefit, is based on the amount that either they have worked in the past and paid into the system, or that a family member has worked into the past and paid into the system if they're a DAC or a DWB beneficiary. I have seen pretty significant Title II payment amounts, but in my anecdotal experience, most of them are kind of maybe just hovering around the federal poverty level, maybe just below or just above. So even if they don't meet that, that actual cutoff, they're still not really in a situation where they have any sort of discretionary income, or they are, you know, able to save and plan for the future. The federal poverty level for 2021 is $12,880 a year, which actually works out to about $1,074 a month. So again, we're just right there. 53% are between 100% of the federal poverty level, which is that 1,074, and then 300% of the federal poverty level, which in a lot of cases is still low enough to qualify for some other needs-based benefits or entitlements. So that's the Title II side. On the SSI side, we know that the maximum amount that somebody can receive as an individual right now in 2021 is $794 per month. So that is already just disgustingly below the federal poverty level, right? As you guys have probably heard, because it was a pretty big deal, the amount of SSI that somebody can get per month in 2022 is going to go up to $840. That's the largest increase in about 40 years. So that's fantastic news, right? But it is still not enough. So from the context of helping people to apply for benefits, it may feel like, well, why do we want people to work? Why do we want to risk their benefits when we work so hard to get on them in the first place? A standard Social Security application can take up to a couple years to get approved. And a SOAR application is, of course, much quicker, but it is very labor intensive. So why do we want to risk this? This is one reason why. The financial ramifications of remaining on just benefits are essentially going to keep people at poverty. These amounts generally don't increase much from year to year. As I said, this coming year, we're going to see the largest SSI increase in 40 years, and it's still nowhere near the federal poverty level. These amounts don't keep up with the cost of living, and frankly, they're not designed to. There is legislation in the works to change that, but who knows what will come of that. So a lot of times when we're talking with beneficiaries about, you know, why they want to go back to work, some of them will say, yeah, I want to work, or yes, I want to work full time, but I'm really worried about my benefits and what's going to happen. And that creates an artificial barrier to employment. And as we know from Lindsay's presentation, work is recovery. And when we're creating a barrier to work, we're creating a barrier to recovery. So there are tons of myths about what happens when someone goes to work while they're on their benefits. So everybody has a story of hearsay. Well, this happened to my friend, or my grandma told me this, or I read this on a message board online. And even sometimes when people go into a Social Security office, or these days call the Social Security office because you can't just walk in anymore, they may get information that isn't applicable to their individual situation, because benefits counseling is a very individualized service. So there's tons of myths and rumors out there. Kind of piggybacking on that, like I said, it can be difficult to find a reliable source of information. We have these word of mouth stories, especially if you work or if you're providing service in an agency that has multiple programs or where clients or beneficiaries can interact with each other. I previously worked in programs where there were also day programs or day psychiatric rehab programs attached to them, and people talk to each other, you know, well, oh, this is what happened to me when I started working with my benefits. So that can create, again, more myths and this word of mouth that kind of scares people when they hear that something happened to somebody else, but they may not know the whole story. And benefits planning is highly individualized and complex. Everybody's benefit situation is different. The work incentives that are available to each individual could be different. What is available to one person might not be available to somebody else, depending on which benefit they receive and how long they've been working. So that right there highlights the need for individualized work incentives planning. And we're going to talk about how to access that in just a little bit. So I want to go over the very basics. Like, this is the absolute basic. This is fall on the East Coast right now. Like, this is me in Uggs drinking Starbucks, the most basic definitions or explanations of what can happen with somebody's benefits when they work. If they are an SSI beneficiary, SSI is a needs-based benefit. So somebody has to demonstrate that they need the benefit because they don't have any other income or resources to support themselves. By that logic, it makes sense that the more money someone makes, the smaller their benefit check will be. So I always think of it like a scale or a seesaw, where the heavier the paycheck side is, the lighter the SSI side is going to be. The way the formula is set up, somebody will always have more money by having a job than just by receiving SSI alone. So even though their SSI check may go down, they will still have more money in the long run. Title II benefits, or SSDI, on the other hand, it's all or nothing. You may have heard of the cash cliff associated with SSDI benefits. It's all or nothing, depending on a couple factors. The length of time that somebody has been working, so whether they've been working longer than 9 months, and how much money they are earning, whether it's more than what Social Security refers to as substantial gainful activity, or SGA. That is basically the amount that Social Security kind of determines is what somebody can, or substantial enough for somebody to support themselves on. If you are earning more than $13.10 in a lot of cases, as an SSDI beneficiary, you can then support yourself, and that would replace your benefit. And that may or may not always be the case. So I'm going to break it down just a little bit more. Again, SSI is like a seesaw or a scale. When one side goes up, the other goes down. The more money that is earned from working, the less the SSI check is going to be. Because of the way that the calculation is set up, again, I want to stress, beneficiaries will always have more money by working. It is not a dollar for dollar offset. The way that the formula is set up, it is actually about a $1 offset for every $2 earned. That's the simplest way of explaining the calculation. There's, of course, more that goes into it than that. But if Social Security is only reducing SSI by about $1 for about every $2 earned, you can understand how it would work out that somebody would have more money by working than by receiving SSI only. Something that I want to stress, because I wish I had $1 for every time somebody asked me or said, well, I can work up to 20 hours a week and still keep my benefit check, right? The number of hours or months worked doesn't really matter. It matters how much money somebody is earning. So here in Maryland, our minimum wage is almost $15 an hour. Whereas the federal minimum wage is, I believe it's still $7.25. So someone who is working 20 hours a week at $7.25 is going to earn a lot less money than someone who is working 20 hours a week at nearly $15 an hour. And that person who is working 20 hours a week at $15 an hour is going to see a much bigger impact on their SSI check and their total income than somebody who is working 20 hours a week at $7.25 an hour. So if you had in your head that the number of hours was the key factor for when somebody's benefits will be impacted by work, just forget it. Just erase it out of your mind. Remember, it's how much money somebody earns. A lot of times people maybe aren't necessarily concerned also about their SSI because, if they're having more money by working, then they're better off financially, but they know that they need to keep their health insurance because their health insurance enables them to continue to have their services. Here in Maryland, supported employment services are funded by Medicaid. I imagine it's like that in a lot of states. Medicaid, pays for doctor's visits, prescriptions, and that sort of thing. So there's a concern that if somebody were to lose their SSI from work and lose their Medicaid, well, that's fine if I don't have my check anymore, but I need my health insurance because I have to be able to have my services and I have to be able to take my meds in order to be successful in employment, right? So Social Security actually gets that. And they added a provision where if somebody is working enough that their SSI benefit stops entirely, they can still keep their medical assistance through 1619B. 1619B is just the name of the provision in Social Security's rule book. But the idea is that they can still keep their their Medicaid. Sorry, in Maryland, we call it medical assistance. They can still keep their Medicaid. And there's no time limit on how long they can keep their Medicaid as long as they meet some basic eligibility criteria, such as still meeting Social Security's definition for disability. There is an income cap for how long somebody can, or the amount that somebody can earn and still keep their Medicaid through 1619B. It actually varies by state. In Maryland, ours is about $41,000. So somebody can earn up to $41,000 and still be able to keep their medical assistance or their Medicaid. So that's SSI. To switch over and talk about the Title II benefits or SSDI, DAC, or DWB, rather than being like a seesaw, I mentioned previously that Title II benefits are more the cash cliff, depending on how long somebody has worked. And the reason why we say that is because when somebody first starts working and they receive a Title II benefit, they have 9 months where they can have unlimited earnings and they would still keep their SSDI check. The point of the trial work period is exactly what it sounds like. It's the time to try out working without fear of something happening to that check. So if you are working with somebody who is maybe on the fence, like, oh, I kind of want to work full time because I really like having something to do with my time, their trial work period is the time to do that because they know they can try it out and see if they're able to manage that with other commitments and family and their mental health, any other conditions they have, and they wouldn't have to worry about their check being suspended at that point. So that's 9 months. After those 9 months are up, somebody would go into what's known as the extended period of eligibility. And at this point, the SSDI or the other Title II benefit is like a light switch or a faucet. I referenced SGA earlier, substantial gainful activity. This is the period in which the SGA matters. So after the 9 months, a Title II beneficiary would have their earnings compared to that year's SGA amount, which in 2021 is $1,310. I think it's going to be $1,350 in 2022. I was so excited over the increase in SSI. I didn't really even look at the 2022 amount for SGA yet. But so if somebody is within their extended period of eligibility in 2021, if they are earning more than $1,310 per month, their SSI would turn, or excuse me, their SSDI would turn off for that month. If the following month their earnings go below $1,310, their SSDI could turn back on. It's like a light switch or a faucet. I always use retail as an example. We're getting into the holiday season. Maybe somebody they work at Amazon. There's going to be a ton more packages to deliver. We know there's supply chain issues and all that. So they're going to be super busy. And Amazon needs them to work 40 hours a week in November and December. So maybe they earn $2,000 a month in November and December. That amount would be more than the 1310. So their faucet would switch off and they would have their paycheck, but they wouldn't be due their SSDI check. Then January comes around and they're tired. They need a break. Amazon's like, that's cool because we don't have as many hours to give out right now anyway. So maybe for January and February, that individual only earns $500 a month. If they're in their extended period of eligibility, that faucet or light switch can turn back on and they could receive their SSDI check for those months. So during the extended period of eligibility, which is 3 years, I don't know if I mentioned that already, it's 3 years long after the trial work period, somebody's their SSDI can kind of turn on and off. This prevents people from having to worry about whether their benefit is going to be terminated or not, and if they would have to go through a whole application process. During the extended period of eligibility, their benefit's just suspended, and it can easily turn on and off depending on how much money they're making. Again, I want to make sure that everybody is kind of clear on this. It doesn't matter how many hours somebody works, only how much money somebody is making. So again, somebody making close to $15 an hour working 20 hours a week is going to be just around $13.10 actually. And somebody who is making $7.25 an hour working 20 hours a week is probably going to be below SGA. That's math in my head, social worker math. We know that Medicare comes with Title II benefits. So similar to Medicaid, if the SSDI is stopped due to work, beneficiaries can continue to keep their Medicare for at least 93 months, which is 7 years and 9 months after the end of the trial work period. So they can keep their Medicare for close to 8 years. In some cases, it's possible that people can keep their Medicare longer than that. Actually would depend on when the first time they go over SGA is, but only Social Security can make a determination that it's longer than 93 months. So we always tell people that it can be at least 93 months. So the extended period of Medicare coverage does have a time limit on it, whereas the Medicaid coverage has an income cap. So that's a good way to distinguish the two of those. So all this is very complicated to understand, right? I just went over the very basics and it probably still doesn't totally make sense. And that's okay. Social Security has developed a couple programs and resources where people can get this information, especially beneficiaries can get this information to help them make decisions when they are returning to work. So the first one is the Work Incentives Planning and Assistance Program, or you've probably heard it referred to as WIPA. The WIPA program is designed to be a source of accurate, individualized information for beneficiaries who are interested in working. So they would contact the WIPA project. The WIPA project would gather some information, verify their benefits, and then they could provide them with information about what that person can expect to happen with their benefits once they start to work. This program is funded by Social Security, so they fund providers across the country, excuse me, to provide this education and assistance to beneficiaries. And again, the information can include an in-depth summary and analysis, assistance with applying work incentives, information about Medicaid and Medicare. They can do referral to other supports and provide information about resources and that sort of thing. So the other one, the other big resource that Social Security started to try to help get benefits information out there and to encourage beneficiaries to work is the Ticket to Work program, which is I work in one of the programs that I oversee as an employment network through the Ticket to Work program. So Ticket to Work was designed to reduce and whenever possible, eliminate dependence on cash benefits. Again, you may balk at the idea of like, oh, why are we going to reduce or eliminate? Well, we know that the reason why is because if somebody is receiving solely just their benefits, they are probably hovering right around that federal poverty level. So the Social Security Administration started Ticket to Work. The goal is to help people between the ages of 18 and 64 who are on benefits get the services that they need in order to find a job and stay employed. So to be eligible for tickets, somebody has to be at least 18, receiving their benefit as an adult. So if they're SSI, they would have had to have their age 18 redetermination. And they have to be under the age of 64, excuse me. So nobody who's like around that retirement age. To implement the ticket program, Social Security sets up agreements with agencies all around the country. It's in all 50 states to provide the employment services. They call us employment networks, hence the Maryland Employment Network. And the employment networks provide services like career guidance, job placement, job coaching, and benefits counseling, because it stands to reason that if somebody is going to work, especially work at a level that may reduce or eliminate their dependence on their benefits, they have to understand the process of what that is going to look like. So ongoing benefits counseling is super important there. To receive services, beneficiaries assign their ticket, that's the terminology or the lingo that we use, to the employment network of their choosing. And there are employment networks across the country. Some work in multiple states or even in every state. Some only work in certain zip codes. Ours work, we operate just in Maryland, but I know of many national ones. And then there are some that operate on like hyper local levels as well. So the goals of the program, again, we want to increase the number of beneficiaries entering the workforce. We want to reduce the dependence on cash benefits, because remember that, you know, was it 53% of SSDI only beneficiaries, or between 100 and 300% of the federal poverty level? And by definition, anybody receiving just SSI is well below the federal poverty level. So we want to support an improved quality of life as a result of advancement in employment and the greater financial independence. The greater financial independence, of course, is important, as is all of the recovery aspects of employment that Lindsay already talked about. So how to get in touch with either a WIPA project or an employment network if you're looking to connect, establish a relationship, or make a referral. The best way to do it is online. Social Security has set up a website there where you can search for the resources. So I have a couple screen grabs, excuse me, here. If you go to choosework.ssa.gov, and then at the top, you can see there's a couple tabs, and here we have the Find Help option circled. So if you're looking for employment networks or a WIPA project, first click on Find Help. Then you can do either a guided search where Social Security is, well, where the system is going to ask a bunch of questions to help determine what they need. So maybe if you're not sure if your client could benefit from a WIPA project or an employment network, what they may need, you can do the guided search and the algorithm will help make that determination for you. Or you can do a direct search. If you know this person just needs a WIPA, or this person just needs an employment network, so I just want to look for certain things, you can do the direct search that way. So this is what the screen looks like after you click on the Find Help tool. Here I have what the direct search looks like. So you can see first thing it's going to ask is the provider type, whether it's the employment network, or vocational rehabilitation agency, a benefits counseling, WIPA, or the legal services. You can click on whether somebody wants in-person or virtual services. A lot of employment networks do one or the other or both. We are currently doing mostly virtual, though when there's not a pandemic outside, we also do in-person services. Some employment networks, especially a lot of national ones or ones that are operating in large states, may only do virtual or may do primarily virtual. You can enter a zip code and a distance. You can also click the specific services that you're looking for. So if you know that you want an employment network that helps with ongoing job support or accommodations, that this person that you're working with is definitely going to need an accommodation in the workplace, you can click that. There's a spot over here for population served. So if you're working with somebody with a vision impairment or a hearing impairment, and you know specifically that they are going to need a provider that can accommodate that, you can click that, check that off there. Languages, of course, and then specializations. So there are some employment networks that specialize in like the TAY population, some specialize in self-employment or veterans. Ours, we work with people with any disability or any diagnoses, but we really do specialize in behavioral health. And then of course you can update your search results. And I didn't go through an entire guided search, but here is the first screen kind of on the guided search page that basically explains that it'll go through 20 questions that kind of would help the software to figure out what the best match for services for the person that you are helping or that you are looking for could be. So if online isn't an option, and of course it may not be for everybody, of course, there is also a hotline that, or a helpline they call it the Ticket to Work helpline. Don't be confused by that. It's called the Ticket to Work helpline, but it can also link you up with a WIPA project that operates from 8 a.m. to 8 p.m. Eastern time. And I have the phone number. I believe the slides have been put into the chat and or a couple times and may get sent out afterwards as well. So the phone numbers are here. Also, if you don't get a chance to grab it today, if you just type into Google Ticket to Work helpline, you'll be able to find it. And they do have a TTY number as well. So with that, I want to turn over to my colleague, Takia Blackman, and she is our peer career and education specialist. I know, Takia, we just changed your title, so I hope I didn't butcher it too badly. But she has some lived experience that I don't want to like do too much of an introduction because her story speaks for itself. So go ahead, Takia.
Hello, everyone. And as always, I'm excited to be here and to share my story. So in about, I believe it was 2015 or 2016, I did attempt suicide. And of course, I'm still here. So I survived. I remember that day so vividly where I texted a friend and I just told her, like, I wish I wasn't here. And I remember at the time that friend did not know that I already attempted. And I was just kind of waiting for the medication to kind of I thought maybe I would go on my sleep. But the police did show up at my house and I was forced, of course, into the hospital because at that point I was a threat to myself. And so I actually started struggling with my mental health and like suicidal ideation at about 11 years old. And so I didn't get help into my early 20s. And that's when I really became passionate about mental health. And so prior to that, I worked in the television industry doing like event planning and public relations for television networks. And while that work was great and it was fulfilling, I really wanted to find a way to use my communications and media skills to really raise awareness for mental health. And so that's kind of what led me to the work that I'm doing with the Mental Health Network, the Mental Health Employment Network, Maryland Employment Network, and other things that I'm doing. Like I've written a book on my recovery story. I've shared my story with thousands of individuals. I've been featured on the news. I was a part of a campaign where my picture was on a billboard in Times Square for Remove the Mass Stigma campaign. And so I've been really able to do a lot by just simply sharing my story. It's very therapeutic to share my story because it allows me to remember how far I've come. It's still not easy. Some days I still struggle, like in complete transparency. Like even now, I'm, battling depression because of the loss of my younger sister 2 months ago. So it's still very challenging. But one thing that I know is that when I share my story, it helps to reduce the stigma. It helps to encourage others who live with mental health challenges, that their life matters, that you can thrive with the mental health condition. And for me, with getting to the point of really not being able to work at one point, and having to give up my apartment and all of that. That's really what led me to become a certified peer recovery specialist. And so I've been able to work one-on-one with clients. I've been able to lead support groups. And people often tell me that after hearing my story, they feel encouraged or they feel inspired because it gives them something to look forward to. You can go to the next slide, Kirsten.
I actually don't have control anymore.
Oh, you don't?
Oh, there we
Oh,
go.
okay.
Okay.
Oh, okay. Yes. Thank you. So for me, like I said, prior to being hospitalized, I was working for a television network, and I was missing deadlines. I had I've had press releases that needed to be written, or I was on a tight deadline and I was late to work all of the time. I couldn't concentrate. It would take me a very long time to complete a very small task. I wasn't, of course, I was not able to take care of my hygiene. I felt hopeless, and I was unemployed for 2 years or a little over 2 years because it gotten that bad for me. And one of the things that I've learned is that in my role as a peer support specialist, now I'm kind of out there in the sense that because of the title, that gives away that I have a mental health challenge or substance use challenge. In my instance, it's not a substance use challenge, but I say all that to say that when you're a peer specialist, people know that you have some type of a mental health challenge. And so it's been very rewarding for me because I feel like I can show up as myself. I don't really have to worry about if an employer will say like, oh, she's not reliable, she's not dependable because she has a mental health challenge. I'm fortunate enough where I can, like I said, show up as myself. I can go to Kirsten and say, I remember last year where I was having a relapse and I had to go into a partial hospitalization program. And I was able to be very open and honest. And that's when I actually got the diagnosis of bipolar disorder, when prior to that, it was just depression. But I went to her and I was very open and honest, and I was able to get her support and kind of work. I was able to work around or have a flexible schedule to the point that I could take care of my mental health, where previously I wasn't able to do that. I was so afraid because I thought people, it would be a judge of my character or my work ethic. You can go to the next slide. And so, of course, eventually I returned to work. I don't know how I have done it all or I'm doing it all. My motivations was, of course, to rebuild my credit because when I was out of work, I depleted my savings. I couldn't pay my bills. And so that was one of the reasons why I was like, okay, I have to go to work. My debt is increasing. I also wanted to live independently because I was kind of couch surfing with different people. And so since I technically didn't have a place of employment, technically I was homeless, even though I was staying with family members and friends. I've even at one point just kind of feared that my car would be repossessed because I couldn't make the car payments on time. But I did have family members who were able to step in and help me. And then I also just wanted to travel. Like I wanted to travel more. And then of course, COVID happened. So then I wasn't able to travel as much. But just last month, I was able to go to St. Croix, the US Virgin Islands. And I was able to do that because of employment. And not just, I mean, I support the Mental Health Employment Network full-time, but part-time, I also support Shepherd Pratt. So I don't know how I'm doing it all, but I think what encourages me is to be able to work with others, to let them know that, you know, it is possible to work with the mental health challenge as long as you have the support. Like I still go to therapy. I still see my psychiatrist. I still have the support of my family members and friends. and letting them know I need something when I'm struggling. And so I realized that it does take a village to support me in my recovery. And I think the biggest thing for me is why I returned to work too, is I wanted to do work that felt fulfilling. It's one thing to just get up and just go to a job. For some people, that's fine. But for me, what drives me is feeling like I'm making a difference. And that is very fulfilling for me. You can go to the next slide. Oh, and I kind of talked about all these things, but how employment has really helped my recovery. I now live alone. I have my own apartment. I was able to travel. I'm a part of a community of peers in the state of Maryland. And then also I've been able to decrease some of my debt and rebuild my credit score. And I am working towards purchasing my first home. And I think, okay, yes. So working in terms of financial independence, like my goal has always been to save for a rainy day or opportunity fund, build retirement, save for a home, travel. I worked with a financial coach for the past 4 years, where she's been able to really help me understand my spending habits, how to increase my credit score, and looking at my credit report, all those things that that were impacted when I had my mental health crisis. Next slide. Oh, that's my story.
And you're sticking to it. Takia, thank you so much for sharing your experience with being a peer support specialist and your journey, and just really that message that you and Kirsten shared about, work is recovery, and utilizing your supports, whether they're your natural supports in the family and community, or also financial planners and benefit planners and such to help you on your journey. So we appreciate that so much. So now we're going to ask our panelists to open back your videos, and we're going to take we're going to go into Q&A now. But before we do that, I wanted to see if I can advance my slides to share some of our resources that the TA Center has created over the years. And it looks like I'm not actually able to advance. So thanks, Susie, for helping me out with that. And also thanks, a shout out to Dave in Alaska, who shared a couple of resources in the Q&A, a link to our resources. We appreciate that. So you can go to the SOAR website and check out some of the resources recreated. This is a great one. Really, Kirsten did a great job helping us with debunking some of those myths about returning to work and backing that up with some facts. Next slide, please. I think we also share one of our conversation guides, which again, help you start that conversation. Can be really, really challenging. So we have some tips on helping you do that. So again, you can access all of these resources on our SOAR website, and the link was again shared below. Next slide, please. Here again, more, these are some little cards, some little handouts that we created through our expert panel that can really help, again, connect folks to understanding, again, more about working and the impact on benefits, and how, again, receiving income from employment can really help you, again, get out of poverty, help you in your recovery, et cetera. So check some of these resources. Next slide. And again, reach out, use our library, start that conversation about work early. I think that was mentioned in all of our presentations. Check out some of those, these acronyms here, find out who your local IPS teams are. Do you have it in your state? Those employment networks and WIPAs, et cetera. And again, some of the resources we shared can help you do that. And again, if you're kind of unsure where to go, reach out to your SAMHSA TA Center liaison. We can help you, again, maybe understand a little bit about what your state is doing around supported employment and utilizing Social Security's work incentives and such. And I think our next slide is about our evaluation. So at the very end, when you log off, you'll get directed to an evaluation. So we ask that you kindly complete that. That really helps us out a lot. So we're going to pull down the slides. Again, you can ask a question in our Q&A box here. We got some great questions in, so we do have some time to answer some of your questions. Kind of grouping up a few questions that came in around just the overwhelming aspect of hearing about work incentives. And again, some of the questions came in before the panelists completed their presentation. So hopefully your question was answered. But again, one of the questions is, like, how do we learn more about this? Like, especially like in my state, how do I learn if we have an IPS program? Specifically, a question came in from Hawaii, Virginia, North Carolina. So maybe Kirsten, can you share a little bit about how can folks find out if there is IPS in their state? And maybe also how to get trained, how to become certified. What's that all about?
For benefits planning or for IPS?
Oh, well, for IPS, is there IPS in my state? And then further, maybe how do I find out where my benefit planners are as well?
Sure. So for IPS, there's the IPS learning community. That is currently done through, and Lindsay, please feel free to jump in because I've actually been out of IPS for a couple of years now. But there's the IPS learning community that is currently done through Westat. So if you look up, you could probably put that just Westat and IPS into Google. Oh, go ahead, Lindsay.
IPSworks.org.
Yeah, there it is. You can find out that should have all of the states on the website that are a part of the learning community. I would also check with your state VR agency to see if they can link you up with any IPS providers. If you're familiar with your state VR agency, it's a government agency that provides funding and resources for individuals with disabilities who are looking to go back to work. And it's set up a little bit differently in every state, but in our state, like in Maryland, it's a part of the Department of Education. In terms of finding the employment networks, so the WIPAs, I definitely would refer back to the slides on the Find Help tool on the website, or contact the Ticket to Work helpline. And if you are interested in becoming certified for benefits planning, or to do that planning yourself, you could check out Virginia Commonwealth University is the entity that provides the training for WIPA projects. So they do certification of benefits planners. Cornell University also does the certification for benefits planners. And there's a third one. I want to say it's Indiana State, but that one is relatively new. So I'll have to look into that one and get back on the third one. But I know for sure Virginia Commonwealth and Cornell University have trainings for benefits planners.
Yeah, and some of our resources does share information on Virginia Commonwealth and also Cornell as well. But we'll make sure we include some of these resources as well. And then again, many questions came in about the Ticket to Work program. You know, overall, some folks are a little bit confused by Ticket to Work, and hopefully by sharing some of those screen grabs about how to really access it online, and then also getting the telephone number should you not be able to get it online. Can you just very quickly, you know, talk about Ticket to Work? You know, what is it exactly, and what is the Social Security Administration's involvement with Ticket to Work?
Sure. So Social Security they started the program. It was a part of the work incentive, or the Ticket to Work and Work Incentives Act of 1999. Started the Ticket to Work program. And so basically Social Security outsources the services. They contract with agencies across the country, and these agencies provide employment support to beneficiaries. So if I'm a beneficiary and I am looking for a job, I may go on the Choose Work website and find employment networks in my area and reach out to them to find, reach out to a couple to find what's going to be a good fit for me. Once I decide what employment network I want to work with, I do the intake paperwork. I complete what's called an individualized work plan with the employment network. That's going to lay out what my goals are. And then the employment network is going to help me meet those goals. So if my goals are, my short-term goal is to finish my degree so that I can achieve my long-term goal of becoming a childcare provider, then that would be identified on the individual work plan. And the employment network is going to provide me services, get me connected to education resources, and help me get my childcare certificates and that sort of thing, so that I can then achieve my long-term goal of becoming a childcare provider. So the employment network provides and documents these services. Typically, an employment network will also provide ongoing services. So even once somebody becomes employed, they would not necessarily, discharge or unassign someone from the program. They would continue to provide support to that individual to make sure that they're able to stay with their job, very similar to IPS. And that if there's a situation where somebody says, well, I don't want to work at this job anymore, I'm going to switch jobs, or I want to go into a totally different field or something along those lines, then the employment network would provide that as well. The services are provided at no cost to the beneficiary. So that's super important. It's funded by the Social Security Administration. Employment networks only get paid when beneficiaries are making progress towards working off of their benefits or achieving financial independence. So there's no cost to the beneficiary whatsoever. Social Security funds the entire program. I think that is pretty much the gist of it. I don't know if anybody has any more specific questions, I'm certainly happy to answer those as well, but that's kind of like the umbrella view.
Mhm. Yeah, great. I just wanted to address that a bit since a few questions came in. And this is a question that I think you can all maybe take a bite out of. A question came in about employers, and just reading this question off verbatim is, do you evaluate the employer's capacity / willingness to deal with mental health issues? And I think we get the gist of that question. Is there education to employers when you are doing job placement and whatever the disability may be, whether it's a mental health or another issue, impairment the individual has? Is there any type of education, or what does the employer know about it? And what should they know or not know about it? And I don't know who wants to take that first. Maybe Lindsay, how do you approach that?
With IPS, disclosure is client driven. So whether or not the client wants us to have a relationship with the employer is going to kind of drive that. However, we do build relationships with employers in the community. So we want to make sure that while we're building that relationship, that we discuss, even if we don't have a client to send them right now, we can discuss what a typical one of our clients looks like and what typical accommodations that they might require. And then once we get an employee that's working for them that is open to disclosure, then we can work with the employer. So if the employer's like, we're having this issue, I don't really know how to handle this, where we sit down with the employee and the employer and kind of discuss what accommodations the employee might need and how we can implement that in the best way for the employer and the employee. So just in the relationship building part of it, there is kind of an educational aspect of it. But once we have a client that's employed with an employer, then we do that if at all possible.
Yeah, I would completely agree with that. We definitely, on the employment network side, we work to establish relationships with employers who may be willing to work with us. We also find that helps, just education in general really helps to reduce this overall idea of stigma within the community. So even if we don't ever end up with an individual that we work with being placed at a particular employer, at least we've provided this education to the employer, since there are a lot of misconceptions and a lot of stigma out there. And we also do disclosure completely based on client choice. I think most employment networks probably do that, since it is a very personal decision whether or not somebody wants to let their employer know that they are living with a behavioral health or substance use condition. We have a position within our employment network called our self-sufficiency development specialist, and she is really, she's done a lot to engage local chambers of commerce and that sort of thing. She's created diversity inclusion roundtables to try to just educate the business community on hiring people with disabilities and working with providers like employment networks and IPS providers and that sort of thing. So it's a work in progress.
Sure. Thank you for adding on to that. We also had many comments, not necessarily questions, but a lot of folks are thanking Takia for sharing her inspiring story. And also Takia shared a link to the book that she talked about. So hopefully folks can access that and take a look at that. So I just wanted to let Takia know, if she can't see herself, how many folks are thanking her for sharing her story. And some folks are asking, because Lindsay talked about education, folks accessing not just work, but education, how to get back to school, finish up their education, take it as far as they can go. How do folks access resources around education? Lindsay, do you want to take us?
IPS, we don't have any like specific resources, just like here, we'll pay for you to go back to school. We do work closely with DRS and vocational rehab. So some clients qualify for funding through that. We help them with the FAFSA. We help them with through the whole process. We also build relationships with the education providers in our area so that they will, they can understand, who we are, how we're helping, how we can help potential students. Like here in my community, we have something called the University Center, and it provides classes from several universities on a campus here in town. And I built a relationship with the admissions department there so that they know who I am. Whenever they see me helping a client, they might understand immediately that, this client might need extra assistance and might need extra help in the financial aid department. And, so we help them do that, and then we help them follow up. So like I have a client who we spend our sessions on Khan Academy, which is an free online resource, working on math activities so that they're practicing for their GED. And that's what their concern is. So that's how we're helping. They think that that's the most helpful way. So it's basically just support throughout the entire process and making sure that, we're experts on what's available in our community to help them find resources.
And I just want to add one thing. I don't know if this is across the country or, but definitely checking your states. In Maryland, the community colleges do tuition waivers for people who receive disability benefits. So they would communicate with I want to say the financial aid office and the disability office, and then the individual would have their tuition waived, not any fees or anything like that. But that is, of course, a big chunk of money to have waived as well. So that is a resource that you can look into in your community.
Excellent. And maybe Kirsten can take this. A few questions again, a lot of questions. How can I access IPS in my state? And you may have kind of answered this, but again, folks are still asking, is IPS in my state? And if not, how can I get it in my state? Or is there an alternative to IPS? Or how can I maybe promote getting IPS in my state if not already?
Ooh, that's a good question. If there isn't IPS in your state, you may want to reach out to your behavioral health authority and find out if they can direct you in any way. And Lindsay, I don't know if you have any other thoughts on this. There is a training process and that sort of thing involved in becoming an IPS program. And of course, there's the meeting of sorry if you guys can hear my dog working at home. There's a training process and kind of like an onboarding, getting up and going, making sure that you're meeting the 8 principles that Lindsay talked about. So it is and I know it is a time consuming process. It's not something that happens overnight, but I would definitely recommend maybe starting with your behavioral health authority to see if they have any guidance on how it could be implemented in your state.
All of the states are listed on the ipsworks.org website that I put in the chat. And if your state does not have one, I would definitely, the Behavioral Health Authority is a great place to start, or contact the IPS learning community personally and ask that question. Because the IPS program was already implemented whenever I started here at Grand Lake, and Oklahoma has done a great job of rolling it out all the way across the state. but all of that was done through our state Department of Mental Health. And I know that other states, that's not the way that it is that it's not always done through the State Department of Health. It's done through employment community centers and some different, there's a whole different structures. But the IPS model it's pretty flexible other than the 8 principles. So definitely reach out to the IPS learning community. They're very helpful. It's available in 26 states in the United States, and it's available in several countries internationally. So just reach out and see on their website whether it's available in your state. And if not, then get a hold of them.
Mhm. Great, thank you. I think a question I'd like to pose to all of you is, what is that one myth about work that you would like to debunk right now? What is the myth that comes up each time that you need to either talk to a case manager or a family member, or your client, for example? Like, what is that one myth that you would like to make sure that folks go away from understanding the fact behind that myth? Is there one that pops out?
That I'm going to lose my check if I work. That is their big fear, because that's been their lifeline for so long.
Mm-hmm.
I completely understand. I mean,
Mm-hmm.
I understand that's been their lifeline. There, a lot of them for most of their lives. So I understand that they're scared. But there are incentives for you to work, and that those incentives can build you out of poverty.
I would agree with that. The other just myth that I hear, and this maybe isn't for necessarily from beneficiaries, but just the general, is that people who have a mental health condition or substance use issue can't work. That I would really, really enjoy if that went away forever, because we know as professionals that people absolutely can work. Everybody can work. It's a matter of finding the right job.
Right. And I think you've all said in some way or another, work is recovery. And I think, Takia, would you like to just close us out? Maybe, is there a myth that when you work with folks, that you kind of, the one that pops up maybe most often?
Whoa, Kirsten stole my answer.
Oh, I'm sorry.
That's the biggest one. I was going to say, it's like, I can't work. And I mean, I always tell people all the time, like, you may not be able to work as much as someone else, giving, the challenges or the restrictions that you may have, but you can work for sure.
That's great. Thanks for sharing that. And I think sometimes you hear that going back to work is going to make my symptoms come back, make my symptoms worse. And I think we've shown through some, research and just hearing stories that no, that is not the case. Work can do so many things to promote your recovery journey. And again, I just want to thank you all for sharing your, your expertise in benefits planning, individualized placement and support. Many folks are asking, what is IPS? And I think after this webinar, folks will have a better understanding of what IPS is all about and how to access this even within your own agency. That may be the first place to start. Do we have this at our own agency? So starting from there, hopefully our resources have really helped steer you in that right direction. We have many questions that came in that really pertain to specific work incentives. So we're going to give them all to Kirsten. Yeah, we're going to definitely get to those questions. We'll answer them. We may send them to the panelists. We may be able to answer them ourselves at the TA Center. But we'll get to your questions. Again, I just want to thank everyone, all of our panelists, Lindsay Horn, who's not here, Lindsay Weber, Kirsten Silver, and Takia Blackman, for giving your time and creating such informative and inspiring presentations. So again, please take that survey or the evaluation at the end of the webinar, and we really hope that you've all gotten some great stuff. I know I've learned a lot from this webinar. Reach out to your TA center if you're interested more in this topic. We had some questions come up about how do I become SOAR certified? So definitely check out the SOAR website about our online course. Reach out to your TA center liaison in your state, and we'll help give you the information that you need. So I just want to thank again everybody, and have a great rest of your evening. Until the next time.
Thanks, everyone.